Good morning, everyone, and thank you for coming today. The last time I stood in front of you, I shared with you the plan to shift towards a more sustainable approach to COVID-19, where we could use an enhanced version of the public health systems that manage other respiratory viruses to also manage COVID. At that time, I promised you that we would closely monitor COVID-19 for a 2-week period and adapt as needed before the remaining changes came into effect on August 16th. Throughout COVID-19, I have been committed to following the data and evidence, and my team has been nimble, adjusting our recommendations as needed when the facts have supported it. Since I made my previous recommendations, I have been watching local and international data closely, and 2 items have emerged that have led me to recommend that we adjust our approach and defer the changes originally scheduled for August 16th. First, current non-ICU hospitalizations in our province are trending somewhat higher than we anticipated. Our initial modelling showed that at this time we would expect to have about 90 total cases in hospital. Compared to 146 cases in hospital today, this is an increase of 62% over our projections. To be clear, there is no issue with hospital capacity. Anyone who needs treatment will be able to get it, either for a COVID-related illness or for an unrelated issue. However, it is important to take some additional time to monitor the situation. Second, we are closely watching the emerging evidence from the United States about pediatric cases with the Delta variant. The experience in the US has been different from the information from the United Kingdom, which we used to inform our original decision. In the UK, the Delta variant did not cause a different experience in children than previous COVID waves. Children under 15 remained the lowest risk of severe outcomes from infection. In the US, unfortunately, hospitalizations in children have started to rise, most significantly in states with lower overall immunization rates. It seems most likely that the reason for the difference between these 2 settings is the level of adult immunization, which is protective for children via reduced household and other community transmission. In the UK, almost 75% of adults have received 2 doses of vaccine, while in Florida, one of the states where high hospitalizations have been reported in children, only 60% of adults have been fully vaccinated. In Alberta, at just over 67% of the eligible population fully immunized, we are in the middle of these 2. Given this emerging evidence, I want to further monitor these trends. I do not share this information to cause alarm. To date, we have not seen a similar rise in severe cases in youth here in Alberta. Since July 1st, we have only had 7 cases in hospital under the age of 18. However, it is important to monitor our trends in a consistent way and to continue to require cases to isolate while we do so. Based on these developing factors, I have recommended that we pause the next step in our transition for a period of 6 weeks until September 27th. Not only does this allow us to do further monitoring, it also gives us more time to increase vaccination levels, which is the #1 most important thing adults and older children can do to protect themselves and younger children and others around them. If monitoring confirms our original expectations that a rise in cases will not lead to high levels of hospitalizations, and we do not see evidence of increased risk for severe disease for children, we will proceed with implementing this next set of changes after September 27th. However, this means for the time being, provincial masking orders for transit, school buses, taxis, and ride shares remain in effect. Isolation will continue to be legally required for those with core COVID-19 symptoms and those who test positive for COVID-19, and symptomatic testing will continue to be available at assessment centres by self-referral. I want to be clear that it is still important for us to continue to work towards a sustainable approach to managing COVID-19 that considers the harms of interventions as well as the direct harms from COVID-19. This is why the changes related to contact tracing that came into effect July 29th remain in effect. We are not going backwards. We are pausing to monitor and assess before taking a next step forward. Having said that, I am sorry that the way that I have communicated about these changes and the rapid pace of them has caused distress. My team is working to summarize the evidence that has informed my belief that this is the best way forward for the health of Albertans, and I am committed to both providing you with that evidence and listening to your perspectives. The other information I am here to share today is about plans for returning to school. I know that we all care deeply about our children and their safety and well-being, and there are a variety of perspectives on how to best balance all the risks they face. With that in mind, the guidance we are releasing today considers the risks of COVID-19, as well as the risks of public health measures on children's overall health and well-being. It is important that we look at all factors that support physical, mental, and emotional health to make sure that precautions are proportionate to overall risk level. It is in this broader context that our provincial guidance has been crafted. We know that the public health measures that were necessary last year to control COVID-19, including the temporary closure of schools to in-person learning, quarantine of entire classes, and cancelling extracurricular events, have been associated with a deterioration in the mental health of children and youth. Many children have reported increased feelings of social isolation, depression, and anxiety. It is important to keep the negative impacts of these measures in mind, particularly when looking at a population that is at lower risk of severe outcomes from COVID-19. Looking at our data right here in Alberta, children have had very low rates of severe illness compared with other health risks. For example, last year in 2020, 4 times more school-aged children were admitted to hospital for fall-related injuries, and almost 8 times as many were admitted to hospital for anxiety disorders than for COVID-19. Overall, less than half of 1% of all diagnosed COVID cases in school-aged children have required hospital care, and thankfully there have been no COVID-related deaths in children. I recognize that for those families who had a child in hospital, the fact that this was rare did not take away that challenge for them. I would not wish that experience on families, and yet I also know that we cannot prevent every health risk for our children. In fact, sometimes when we take action to avoid one risk, we increase risk in other areas. We have worked closely with Alberta Education and Alberta Health Services to develop guidance to prevent and manage all respiratory illnesses in schools. This guidance includes expectations around good public health practices such as staying home when sick and regular hand hygiene and cleaning. Masking will not be universally required in schools across the province, but may be recommended as one of several temporary interventions for respiratory outbreaks in general. Throughout the coming school year, school officials can also make decisions that are right for them and their communities. This includes the ability to consider putting health measures in place for their schools that may exceed those put in place across the province in response to particular needs and contexts in their areas. It is also important for families to consider their individual risks and contexts and make decisions that are best for them, such as for those who may choose to continue to wear masks. In return, schools and school authorities are expected to support these personal choices wherever possible. The best choice we can make to protect ourselves and our children is to be fully immunized. We have a strong ally on our side with vaccines. Having as many people immunized as possible will protect both those who have received their vaccine as well as those who are not yet able to get one. This is why, before the school year begins, I am asking all eligible Albertans to get vaccinated against COVID-19 as soon as possible. The school year begins for most students in about 3 weeks, and it takes about 2 weeks to develop the highest protection after getting your second dose. Although it is best to get a vaccine before school starts, for those who aren't able to do so, we will also offer COVID-19 vaccines in schools. Immunizations will be available through temporary clinics in schools for students in grades 7 to 12, as well as teachers and staff starting on September 7th. Right now, only about half of youth 12 to 17 are fully vaccinated. Providing vaccines through school ensures vaccines will be accessible to all eligible school-aged Albertans in the province. By continuing to get fully vaccinated, following recommended guidance, and managing outbreaks, together we can support children safely returning to school this fall. We have been through a lot in the past year and a half, and our kids' lives in particular have been profoundly changed. COVID has taken a lot from them by the impacts of the measures that we have needed to use to protect our communities. However, vaccines give us the chance to change that. I wish everyone a healthy return to school, and I will now turn the podium over to Minister LaGrange.
Thank you, Dr. Thank you, Dr. Hinshaw, and good morning to everyone. Thanks to the power of vaccines and the dedication of Albertans, parents, students, and school staff can look forward to a normal school year this September, which includes a return to in-person classes, field trips, team sports, extracurricular clubs, school celebrations, and reconnecting with friends and colleagues. International student programs, work experience, and graduation celebrations can all continue as they normally would, and all with no restrictions. I'm very much looking forward to a normal school experience this fall, and I know there are many, many Alberta parents and students who are also looking forward to it. In June, we provided school authorities with a guidance document for the 21-22 school year so that they could start planning for this fall. We also promised that additional guidance would be coming mid-August, and I'm pleased that we have met that timeline. I'm grateful to Dr. Hinshaw and her team of experts for providing critical, needed guidance as schools prepare to welcome students and staff back this fall. The public health guidance information tells us how to manage and prevent respiratory illnesses, including COVID-19, taking into account students' overall well-being, mental health, and learning needs. While schools will not have to follow last year's measures, they will still use good health practices and follow certain health guidelines. Students will return to in-person learning and many activities with no restrictions, consistent with the extended timelines for easing COVID-19 measures that Dr. Hinshaw just announced. Students and school staff should screen daily for core symptoms and must isolate if they have the core COVID-19 symptoms or test positive. Although masking will not be mandated in schools, it will still be required on school buses until at least September 27th. A detailed 2021-22 school year plan contains 2 contingency scenarios for continuing student learning if there is a significant change in the COVID-19 situation. Measures like cohorting, masking, and spacing will not be required, except in an outbreak situation, which Alberta Health Services will determine with our schools. And everyone who wants to wear a mask must be supported to do so. After all, we all need to make choices based on our individual situations. Getting vaccinated, staying home when sick, good ventilation, cleaning, and hygiene practices are all key to ensuring we can keep moving forward. Throughout the pandemic, we have trusted local school authorities to make decisions that work for their schools and their school communities. School authorities have the ability and the corresponding accountability for any additional local measures they may choose to put in place. This could include physical distancing, cohorting, and mask requirements that may exceed provincial guidance. And at this stage of the pandemic, we believe such measures are best left to local authorities to decide for themselves. As Dr. Hinshaw has said, Alberta Health Services will be working with school authorities to administer COVID-19 vaccines in schools for students in grades 7 to 12, teachers, and staff. School authorities have a long history of working with Alberta Health Services to deliver in-school vaccination programs, and I am confident that school authorities will welcome public health officials into their schools quickly to offer any additional ways to get the COVID-19 vaccine into arms of students and staff who need their first or second dose. It is so important for Albertans to get vaccinated to protect others. Vaccines are safe, they are effective, and they save lives. I echo Dr. Hinshaw in encouraging parents not to wait for their children to get their first or second shot at school. Everyone who is eligible to get vaccinated should do so as soon as they are able. I also know parents are concerned about younger children. I understand firsthand the anxiety this creates for parents, guardians, and loved ones. Every parent and every family will need to think about their personal situation and take precautions that make sense for them. I know this is challenging for many, and I believe that as more people get vaccinated and as we continue to follow good health practices, we will help protect each other. We knew there would be challenges when students returned to school and to classes last year, and Alberta's government ensured we were there to support our students and our staff. Prior to the pandemic, school boards reported $363 million in taxpayer operating reserve dollars. At the end of the first wave of the pandemic, school boards reported $383 million in taxpayer operating reserve dollars. And early data shows that school boards have over $400 million in taxpayer operating reserve dollars. This highlights that school divisions have been able to increase their reserve dollars during the pandemic, and I'm confident that school divisions have the funding they need as they go back to school. In this upcoming school year, we are also providing school authorities with more than $130 million in COVID mitigation funding. School divisions can use this money as they see fit to address their local needs. This is on top of the over $1 billion in support school divisions have had access to during the pandemic. Alberta's government provided school divisions with $250 million in accelerated capital maintenance and renewal funding for things such as HVAC and mechanical upgrades. It should be noted that of the $250 million provided by the provincial government, school divisions chose to spend approximately $44 million on HVAC and ventilation upgrades in schools. We also made sure that students, families, and Albertans could access mental health supports and referrals from anywhere in Alberta. And this year, to jumpstart student learning, all school authorities can access $45 million in new funding for intensive small group literacy and numeracy programming for students in grades 1 to 3. This funding will help ensure that no student gets left behind. As we enter this new school year, learning in a safe environment remains our top priority. We will monitor the situation closely. We will remain in regular contact with school authorities to address challenges that may arise, and we will continue to follow the expert advice of our Chief Medical Officer of Health and her expert team. I'm confident everyone will continue to do their part to keep our schools safe as learning continues. I am incredibly grateful for all and want to personally thank every teacher, parent, student, school member, administrator, board trustee, and anyone who's involved in education for their diligence and hard work to keep our communities safe. I encourage everyone to read the guidance document and other helpful information, such as the parent guide, on alberta.ca/return to school. And if you or anyone you know is unsure about vaccinations, please visit alberta.ca/vaccines. You'll find helpful facts to counter common myths, explaining how vaccines are safe, are effective, and save lives. Once again, thank you to Dr. Hinshaw and her team for preparing this guidance document for our schools. I want to wish every student, every parent and staff member the very, very best as they wrap up their summer and look forward to an exciting new school year. Thank you.
Okay, thank you, Minister. We are now going to turn it over to questions. We ask that you keep the question to one question and one follow-up. Please indicate who your question is for. If you're here in person, please line up behind the microphone. And while you head over there, we'll go to the phones first. Operator, can you please put through the first caller?
First is Licia Corbella with Post Media. Go ahead, Licia.
Thank you. Good morning, Dr. Hinshaw. You said in your comments that 8 times more children were hospitalized for anxiety disorders than for COVID during these past 18 months. Was this as a result of the lockdowns or health measures? And how does this differ from previous pre-COVID years? Do you have any hard numbers on that?
Thank you for the question. The data, to be clear, from hospitalizations for anxiety is from the year 2020. So when we're looking at comparisons, we're looking at a year and a half of COVID data compared with only 1 year of the other data. We don't have the most recent data on pediatric hospitalizations for other issues other than COVID, which we're tracking closely. So in fact, the difference, if we were just to look at a 1 year time period, would likely be even greater. The difference between the hospitalization level, pediatric hospitalizations for anxiety in 2020 compared with previous years is slightly higher, not dramatically higher, but it is interesting to note that other types of hospitalizations such as asthma. So in 2020, there was a dramatic drop in pediatric hospitalizations for asthma, which is one of the reasons why I believe it's critical that we look not just at COVID, but other risks and consider what kinds of sustainable interventions help to protect children from multiple respiratory infections, not just COVID. So again, the anxiety-related change was minor, but it was slightly higher than in previous years.
Do you have a follow-up?
I do. So I've actually spoken with a father of a daughter, 12 years old, who killed herself, and who he attributes that to having to have been isolated a few times through the school year. And so I'm just wondering if you have seen an increase in suicides amongst children over this time.
First, let me say that that is a tragedy, and my condolences to that family. That's a situation that no one should have to face. And if anyone is struggling with mental health issues, it's important to note that there are supports available, and would encourage anyone who's either personally or indirectly through a family member struggling with that to reach out through either HealthLink or look for resources online through Help in Tough Times at Alberta Health Services. So again, this is something that we do have supports for. We have not seen an overall increase in suicides compared to previous years. I don't have the age breakdown for that, but when we look at 2020 compared to previous years, the overall suicides thankfully actually seem to be somewhat lower. However, I want to stress of course, life lost is a tragedy, and that we need to do everything we can to prevent that.
Operator, can you please put through the next caller?
Next, Kelly Kreiderman with the Globe and Mail. Go ahead, Kelly.
Hi, Dr. Hinshaw. I'm wondering, you referenced that hospitalizations are higher than you would have expected at this point. Will you release some of that data so we know what you're measuring and what is factoring into your decisions about removing these restrictions or removing these test, trace, isolate measures or not?
Absolutely. I committed to doing that last week, and my team has been working hard on a synthesis of all of that evidence in a form that we can release publicly. The challenge is, of course, with some of the changes that we've noted over the past week with the analysis required on those, to put forward a changed recommendation and then to implement the change once the decision was made. There's been quite a lot on the team's plate this week, so it hasn't moved quite as quickly as we wanted it to in terms of that evidence summary. So that is something that will be released, and again, just we need to make sure that we're putting it together in a way that isn't just fragmented bits, but it's actually a kind of synthesis of all of that evidence that lays out the rationale for the recommendations that I have made.
Do you have a follow-up, Kelly?
Yes, I do. I'm wondering why the decision was made not to have a universal masking mandate for schools this fall in place.
We know that masking is something that is a reasonable extra layer of protection against multiple respiratory viruses. We also know that masking comes with some challenges, such as difficulty with communication and social interactions. And in fact, last year when we had a universal masking mandate in our schools, it was for those in grades 4 and up, the older children for whom there was, again, a greater risk of transmission. So now that older students who are the most likely to transmit are able to access vaccines, which again is the #1 most important thing we can do, and knowing that last year we did not have a provincial mask mandate for those in grades 3 and under because of some of those challenges, it was my belief, as we have done with previous policy decisions, that there needed to be local input and flexibility because it's really those who are most impacted by the decision who need to be able to inform weighing out some of those risks and benefits. And so that is why, again, there's no requirement at a provincial level, yet there is that ability for local decision making informed by local perspectives and weighing out some of those risks and benefits.
Operator, can you please put through the next caller?
Next is Kyle Moore with Kix FM. Go ahead, Kyle.
Hello. My first question here is for Dr. Hinshaw. Now, up here in kind of the northwestern part of the province, we do have some of the lowest vaccination rates up here. In fact, if you go up to the Mackenzie area around high level, they have actually the lowest vaccination rates in the province. What are kind of some of the things that you're like to see happen here when it comes to getting sort of more people up here vaccinated? Because that's something that the doctors up here have been kind of vocal about recently.
Absolutely, and we continue to make vaccines available through a variety of options. There are still Alberta Health Services clinics running, pharmacies have vaccines, many physician offices in the province have vaccines. We know that there are still those who have questions about vaccines, and we're making that information available to people through a variety of sources, both directly from our website, working with local groups. So we are having town halls with different municipalities, and working to support, again, kind of local decision makers to consider what are the kinds of things that might help overcome the barriers that are being experienced in that particular area. There's also mobile vaccination options such as the TRAX bus that is going to different parts in the province where we are seeing that there's opportunities to increase uptake, and we will, as I mentioned, be making vaccines available in schools for those who have not yet been vaccinated and for students for whom parental consent is obtained. So we are trying to make it as easy as possible, make that information as available as possible, and to work with local partners who have a better idea of what some of those local barriers might be.
Do you have a follow-up, Kyle?
Well, the next question I got here, it might be slightly better for Minister LaGrange, but as I kind of hinted at earlier, a lot of the lower vaccination rates around the province are certainly in different rural areas. When it comes to sort of helping schools in rural areas, what kind of, well, these some of the measures that are announced today, how will they sort of help those rural schools in the province?
Thank you for the question, Kyle. So very much rural schools will be part of the vaccination program. We will absolutely provide the supports that they require. They have access to the additional funding. As I've indicated, along with all school jurisdictions right across the province, we're in constant contact with education partners should they require anything further. I have an open dialogue policy that they can always contact us for further information. But as Dr. Hinshaw stated, the vaccination programs that we will be rolling out in schools, we have a long history of vaccination, vaccinating students within our schools. So that is just another tool, another element that we can provide to our whole overall system to ensure that as many people who want to be vaccinated are able to be vaccinated in a timely manner.
Okay, we will now go to questions in the room. Go ahead.
Hi, I'm Audrey Naver from French CBC. My first question would be for Dr. Hinshaw. I think quarantine is not mandatory anymore for close contacts of declared cases, but you mentioned that cohorting, masking, and social distancing could be required in certain scenarios if there's an outbreak. Can you give more specifics as to what those scenarios would be and under which circumstances an outbreak could be declared in schools, obviously?
Sure. So public health has a long-standing practice and partnership with schools. And it's been the practice for many years that if a school experiences a 10% or greater absenteeism, and the absenteeism is due to an illness, and that could be a kind of a stomach bug, so more of the stomach experience, or it could be respiratory, so more of the cough and fever, then public health, and again, this is long-standing, public health would assist the school to understand what the kinds of illnesses were and what kinds of measures might be needed in the school to prevent further spread. And so the plan is to build on that pre-existing relationship with schools, have that initial assessment through local public health of what the kinds of symptoms are. And then if the symptoms are of a respiratory nature, so again, kind of cough, fever type issues, then there could be a recommendation from that local public health team about a temporary bundle of measures that could go into place in that school, such as stricter symptom screening, pre-attendance, use of masks for a temporary period. And again, I want to emphasize that we need to learn from the lessons of COVID, both the good and the bad in terms of moving forward and try to support the overall health of kids, again, not just from COVID, but some of those other things like influenza that can also cause severe illness in children.
Just a clarification, that's per school, not per school class, right?
Per school, correct, yeah.
My second question could be answered by you or Minister LaGrange. You mentioned that those changes, delaying them for 6 weeks, is in part because of the change in the situation for kids, but elementary school kids cannot be vaccinated right now, so why are the measures not different for them compared to middle and high school children?
I'll maybe take that one, and to say that certainly there's a lot of discussion about the approaches to kids, and I think it's important to allow space for reasonable people to have different opinions in this space, because what we all want most is the health of our kids, and that is a common interest I think that we all share. What we, I think, sometimes differ on is the understanding of, again, not just COVID risks, but other risks. And so, for example, as we're looking around the world, there's jurisdictions such as the UK, where they're not currently providing widespread vaccine for anyone under the age of 16, and yet they have chosen to go back to schools with no masking in schools, broadly speaking. And yet there's other jurisdictions that have chosen to do so. So as we looked at, again, at the different approaches based on, again, weighing out all of those different risks and benefits, we know that universal masking, especially as it pertains to some of the communication and social interaction challenges, can be differentially impactful for the youngest kids. So really felt that that decision, weighing out those pros and cons, needed to be done informed by local perspectives of those who are most impacted, and that it would not be appropriate with all of those different pieces to put in place a mask mandate that would in effect be more restrictive than the one we had last year, which only applied to grades 4 and up.
Go ahead.
Hi, it's Bill from CTV. My first question is sort of political and medical, so I'm hoping Dr. Hinshaw can speak to the medical side and the minister to the political side. When the plan was first announced to drop, symptomatic testing, mandatory isolation, there was a tidal wave of opposition to that. Some of these people were openly attacked and even mocked by people within your government. Is today's announcement an acknowledgement that those people were right? And what do you say to those people who came out and said cases are going to go way up, hospitalizations are going to go way up?
So I'll speak from the medical perspective, perhaps, and then turn it over to Minister LaGrange. I believe that one of the most concerning things that's happened during the pandemic is the polarization and the difficulty in having respectful dialogue across differences of opinion. And I believe that with very complex and even wicked problems like COVID-19, we are not well served by engaging in holding on to positions rather than identifying that we have common interests. We may have different ideas about how to get there. And so I would say that it's critical that we open space for respectful dialogue and to share perspectives, to be able to have that discussion. And certainly no individual is infallible. I have never claimed to be infallible myself. But I would also say that individuals who have different perspectives on how to move forward are not infallible either. And so it's critical that we find a way to open that respectful space for dialogue, share opinions, be able to have conversations. This particular recommendation change for me is again based on a continuous evaluation of the evidence and my responsibility as the doctor for the population. When I prescribe a course of action for the population, as I shared 2 weeks ago, I did not give enough time for people to kind of think through why I was doing that. I did not share the evidence in a robust way, and I am sorry about that because I know that that has made things much more difficult. I commit to sharing that evidence, and I do think that again, reasonable people can disagree on this, and there are different possible paths forward. As we can see around the world, there's no one single right answer to COVID, and if we don't open that space for discussion, we will all be the poorer for it. And I'll leave the rest to Minister LaGrange.
Thank you, Dr. Hinshaw, and I echo that same sentiment. We need to be able to have respectful dialogue. From a government position, we've always said we are going to follow the science. When Dr. Hinshaw brought forward her recommendations to Cabinet a number of weeks ago, that we followed her recommendations without modification. And so when she brought forward further recommendations, again, we're following the science and the advice of our Chief Medical Officer of Health. She has served us really, really well, and we thank her for her dedicated service to Albertans.
Do you have a follow-up?
Just a quick follow-up, and this one is for Dr. Hinshaw. So we're looking at the date of September 27th now. So I'm wondering, is that a hard date, or is there a possibility that we're back here, the Friday before that, hearing the same thing? If the case numbers get worse, if hospitalizations get worse, if hopefully it doesn't happen, but if deaths get worse, could, the mandatory isolation and the symptomatic testing extend beyond September 27th?
The purpose of monitoring is to be able to assess exactly that. What we've noted in our local hospitalization data is not a dramatic change. It is an increase, as I mentioned, that I believe we need to monitor. However, if it doesn't worsen, if it stays within that bound, and we will be able to release that modeling again when we complete that synthesis of that package. The decisions that were made were based on that projection that showed that even with an increase in cases, having the vaccination level that we do would provide a decoupling of cases from severe outcomes. And so we do need to continue to monitor, and if our predictions based on that modeling are proven to be significantly wrong, or again, if we see that there are more severe outcomes for kids from this Delta variant, then we may need to adjust our recommendations. However, I do want to point out again that the evidence is not conclusive on either point. And so whether or not, again, we need to make some adjustments to this approach, ultimately, how we have managed COVID before widespread vaccine availability is neither sustainable nor good for the overall health of Albertans, and we do need to consider making that shift, the timing of which will be informed by the data.
Okay, we have time for one last set of questions. Go ahead.
Hi, it's Janet French from the CBC. First question is for Minister LaGrange. You talked a little bit about school board autonomy, and also in the preliminary 2021 school reentry plan, there's discussion about how school authorities will have the autonomy they need to make local decisions. But what are you doing to ensure, these are school divisions, they're not health authorities. What are you doing to ensure that they don't face legal liability for any decisions they might be making that could potentially be perceived as outside of their jurisdiction?
Well, they're locally elected officials, and they have that authority, and they also have the accountability to their electorate, to their parents, to ensure that they are making decisions that are in the best interest of their local communities. And as such, they are covered from legal liability because of that. When they go above the guidance that is provided by Dr. Hinshaw and her team, then they have to assume that responsibility. And so it is incumbent on our school divisions to really ensure that they talk to their parents, let their communities know why they feel strongly that they need to go above the guidance that is being provided by the province.
You have a follow-up?
Yeah, I'm not sure if it's for Dr. Hinshaw or for Minister LaGrange. You talked about how schools can still have this ability to, require classes to isolate if there's a positive case. But I mean, after September 27th, you may not have that information if there's no more widespread testing. So how are schools supposed to prevent outbreaks or try and contain outbreaks if they don't have that information that they would be getting prior to September 27th?
I think this is a question for Dr. Hinshaw. So Dr. Hinshaw, I'll leave it to you. Thank you.
One of the key pieces of the plan forward is that we really have to stop treating COVID like it is the only and most significant risk for our children. We know that other respiratory viruses can also cause severe outcomes in kids, and part of the shift that we are making is to support a sustainable transition that can help schools look at when they're having these surges in absenteeism, that there's a response that's appropriate to help not just with COVID, but other respiratory viruses. And again, the required isolation that will be continued up till September 27th does not include required quarantine for whole classes. We recognize that intervention, which I believe was necessary last year prior to widespread vaccine availability, that is highly disruptive and causes significant harm. And so what we will be doing, again, is requiring isolation of those who have COVID core symptoms and those who have confirmed COVID. But we will not be requiring that classroom quarantine even prior to September 27th. And we'll be working with schools to shift towards, again, that symptom-based approach that can be effective and support schools and kids for not just COVID, but for other infectious illnesses as well.
Okay, thank you, everyone. That's all we have time for. If you have any follow-ups, please reach out to myself or Dr. Hinshaw's team.